Welcome, and thank you for joining us for a Healthy Living lecture event on aging and heart health. It's hosted tonight by Henry Ford Senior Healthy Living Program. I am Natasha Smith, a physician assistant from the Henry Ford Health and Vascular Institute, and I will be your moderator for this evening's lecture. Tonight, you will hear from cardiologist Dr. Brittany Fuller on aging and heart health. Dr. Fuller is an interventional cardiologist with Henry Ford Hospital in Detroit. Dr. Fuller specializes in the treatment of complex heart blockages, utilizing minimally invasive techniques with balloons and stents. She is also skilled in the treatment and management of cardiogenic shock, which is when the heart pump fails and may require temporary mechanical support. Dr. Fuller also works with the obstetrics team in managing high-risk pregnant patients that have heart problems. When it comes to Dr. Fuller's care philosophy, Dr. Fuller states, and I quote, "I believe all patients should have access to equal care and that you should treat patients with the same respect, dignity, compassion, and provide them with the same level of high-quality care that you would give to your own family," end quote. I have had the privilege to work with Dr. Fuller in the cath lab for many years now, and I'm truly excited to have the opportunity to introduce her to you tonight. Please note that following Dr. Fuller's presentation, we'll have a question and answer session. We ask that you please type any questions that you have into the chat box, and please do not share any personal medical information in your question. Also, to ensure a smoother experience for all, please turn off your cameras, and please note that your microphones have been muted. This lecture is being recorded and will be available to listen to again on the Healthy Living Lecture Series webpage at henryford.com/healthy living. Now, I'm happy to introduce Dr. Brittany Fuller.
Thank you so much, Natasha, for that introduction. And thank you guys for coming tonight to hear me talk. I'm going to share my screen with you. All right, very good. So we're going to talk about aging and heart disease. A couple of things I'm going to go over. I'm going to talk about what heart disease is, risk factors, the big ones, hypertension or high blood pressure, hyperlipidemia or high cholesterol, diabetes, and then general treatment and prevention. So what is heart disease? So what happens as we get older, which has nothing to do with what we ate or anything like that, with other risk factors, high blood pressure, high cholesterol, risk factors, family history of heart disease, plaque starts to develop and grow within the wall of the artery. And over time, it actually causes significant narrowing of the inner surface of the artery. And then eventually it causes that artery to may even close, but can cause chest pain and even heart attacks. So a heart attack is actually when the artery actually is closed to the point where there's no more blood flow going past that blockage, or it's so tight that there's limited blood flow going past that blockage, which can cause chest pain and chest tightness. So I like to bring this up because men and women may have different symptoms. Men typically have, again, that pain in the chest, pain in the arm, neck, or jaw, shortness of breath, heartburn type symptoms, and sweating. Whereas women may not have those symptoms. They can, but they may just have shortness of breath, unexplained fatigue, or they can't sleep, shortness of breath, pain between their shoulder blades, dizziness. These are things that, if they're completely out of the ordinary for you, may be a sign of a heart attack or heart disease. There are multiple different ways that your doctor can evaluate that, and I want to kind of step away from actually telling you which was going to be the best test for you. But if you have symptoms, your doctor may want to do what's called a stress test. There's multiple different ways that we can do a stress test. That can be on a treadmill if you're able to walk. That can be with medication, where you're just kind of going through a scan and they give medication. It can be with a CAT scan, which is essentially just looking at the arteries via CAT scan, or it can be with an MRI. But I will defer that to your own cardiologist or your own physician on what test they may choose to be the best option for you. After you've had a stress test, or even if you've had a heart attack, you may be referred for something called a coronary angiogram. That is where a catheter, which is essentially a bigger IV, is placed in the artery of your arm and your wrist or in your leg. And then all pathways lead to and from the heart when we're talking about blood vessels. So if they're starting in the arm, they'll give you medication, and that catheter goes up to the heart. And if they're coming from the leg, it again goes up to the heart. With that, under X-ray, we can inject contrast dye and actually look at the arteries in real time to see if there's blockages and even potentially fix them with angioplasty. So I just wanted to kind of give you an idea of what angioplasty, some of you may already have had angioplasty or been referred to bypass, just to kind of give you an idea of what that means. So what I do as an interventional cardiologist, I manage things on the right side of the screen, the stenting or balloon angioplasty. And that's essentially where there's a blockage in the artery that I put a wire, a very, very small wire past the blockage in a balloon. And then I kind of balloon and crush all of that plaque that's now invading and causing a narrowing in that artery. I push it to the side, and then I put a stent, which is just a metal scaffold that's coated with medication, and it's mounted on a balloon. So over that wire, I can actually put the balloon with the stent. As I inflate the balloon, the stent actually expands and adheres or sticks to the wall of the blood vessel. And then the balloon and the wire come out, the stent stays in place. It becomes a part of your body. Your artery tends to eventually grow around it, so you need medication to maintain that opening. But this is what I do every day. That's something that you may be referred to when we're talking about heart disease. Sometimes you may be referred for bypass or open heart surgery. So that's essentially where there's multiple blockages in multiple different arteries, and the surgeon takes a conduit, which is just like an artery that you already have in your body, and they detach it from the wall and then attach it past the blockage. So they don't clean up the blockage; they just attach a pathway from the aorta and past the blockage into the artery, so that the blood is now leaving the aorta, passing the blockage, and your heart muscle is getting the blood flow that it needs. The difference is one is an open heart surgery, the other one is not. Which one is the best option for you? I, again, would defer that to your cardiologist, but both are excellent options. So I am going to move into, so that's heart disease, and there's a lot of different risk factors. That the big ones that I'm going to talk about: hypertension or high blood pressure, high cholesterol, and diabetes, and just kind of touch on each of those and things that we should be mindful of and pay attention to, and things that your doctor that may want to target to decrease your risk. So what is hypertension? So as blood leaves the heart to provide oxygen and nutrients to all of the organs in the body, it travels through these tubes called arteries. Again, that's that pathway. All pathways lead to and from the heart. So these arteries carry blood, all of that oxygenated blood and nutrients, away from the heart to all of your organs. So as what happens with your blood pressure is that's the pressure that's pushing against the wall of your arteries. So if that pressure is high, if it's above 120/80, then that's technically high blood pressure. So normal blood pressure, I would say, and I would encourage everyone to know your numbers. Normal blood pressure is that top number or systolic number is less than 120, or that bottom number or diastolic number is less than 80. As long as you don't feel dizzy, lightheaded when you're standing up and moving around and you feel normal, your blood pressure, even if it's in the 110s over 60s, is perfectly fine. When you start getting into above that 120/80, that's when we start saying that your blood pressure is a little bit elevated. We may not recommend medication for that at that point, but working on diet and exercise, which I'll talk a little bit about in later on, a little later in the talk, we may want to recommend some of those things. And then when you start getting into that first stage of hypertension or high blood pressure, which is that 130/80, that's when we start to recommend medications. And then, of course, if your blood pressure is greater than 180/120, especially if you have symptoms that is an emergency, you got to get to an urgent care or an emergency room very quickly so that we can safely get that blood pressure down. So how do you know if you have high blood pressure? So high blood pressure typically does not cause symptoms. That's why it's often referred to as the silent killer. If you have symptoms associated with high blood pressure, that could indicate that there's a significant problem that you're having and that you need to get into a medical facility to be treated. Those symptoms can be headache, shortness of breath, nosebleeds, chest pain, chest pressure, dizziness, a general unwell feeling. I typically tell patients, you don't typically feel high blood pressure unless you have a heart attack, a stroke, or heart failure. So it's very important to follow up regularly with your primary care physician or doctor and make sure that you know your numbers and know your blood pressure so that we can avoid those things. So how is hypertension or high blood pressure diagnosed? That's just with a blood pressure cuff. So what happens is, again, these arteries carry oxygenated and nutrient rich blood away from the heart to all of your organs. There's a cuff that preferably on the upper arm is the better cuff. But if you have one on the lower arm, that's perfectly fine. I would just recommend that you take that to your physician's office and make sure that it correlates with what they're getting in the office so that your blood pressure is actually, you're recording accurate readings at home. So what happens is we inflate the blood pressure cuff until at a certain number to where you don't hear any noise, and then we start to deflate it, and then we hear two sets of noise. That first noise is your systolic or your top number, and then when we stop hearing the noise, that's your diastolic or your bottom number. If you have a blood pressure cuff at home, there's some things that you should certainly make sure that you do when you check your blood pressure to make sure that you're getting an accurate reading. Because some people, when we go into the doctor's office, we may be a little bit nervous, and your blood pressure can tend to go a little bit higher than what it normally runs at home. So we want to make sure that we're not over treating you with medication. So if you check your blood pressure at home, that's going to be your most accurate reading as long as your blood pressure cuff matches what we get in the office. So what I want you to do is when you check your blood pressure at home, make sure you go to the bathroom before, because if you have to go to the bathroom as you're checking it, that can often increase your blood pressure falsely. Don't talk while you're taking it because that can also increase your blood pressure falsely. Make sure you're sitting in a chair that supports your back. So not a bar stool. Make sure you're not sitting on the floor, sitting in a chair that supports your back. Both feet flat on the floor. Don't cross at your ankles. Don't cross your legs. Have your arm rested on a table. If you need to put pillows underneath to make it level with the heart, do that. And then I always tell people to wait a minute or so. Think happy thoughts. Think of yourself on a beach somewhere, and just relax for a minute or so and then check your blood pressure. That is going to be your most accurate reading. And then I often tell patients, don't check your blood pressure multiple times a day. That tends to induce anxiety, and it also tends to cause you to have very, unreliable readings. So checking it once, at most twice a day, trying to keep it consistent with the time of day you check your blood pressure is going to be your most accurate readings. And then just keep a log so that we can kind of get a trend of what your blood pressure is normally running at home. I like to put this, I put this in here just to give you an idea of what blood pressure cuffs may cost, especially if they're the upper arm cuffs. Meyer tends to be relatively reasonably priced at about $30. Rite Aid, Amazon, anything that's going to be cost effective, but one that preferably has a digital reading, one that will actually do the measurement for you. You don't have to do a lot of work. You just put your arm in the sleeve and let it take your blood pressure. That's going to be the one that's most accurate. The one that goes on the upper arm is, again, the most accurate one, but if you do have one that goes on the wrist, that's fine. Just take it into your primary care physician or your doctor's office and just have them check your blood pressure with your cuff and with the office cuff just to make sure that they correlate. So moving on to hyperlipidemia or high cholesterol. So there's a lot of numbers that we get when we get a blood panel to check your cholesterol. There's a total cholesterol number. There's your HDL, which is typically referred to as your good cholesterol, your LDL, which is typically referred to as your bad cholesterol, and your triglycerides. The one that we tend to, as cardiologists, tend to focus on the most is your LDL, which is your bad cholesterol, because that's the one that we target that a lot of our interventions, whether that's medical therapy and diet, there's a specific number that we tend to target that's associated with decreasing your risk of having heart disease. And the good thing is when we target your LDL, it targets your total cholesterol too. And as you're making these healthy changes, your good cholesterol will tend to change, and so will your triglycerides. So the number that we really start to get worried about is your LDL when it's above 160, particularly if you have risk factors. We may actually recommend medical therapy, and in addition to diet, we always will recommend diet, which I'll talk a little bit about diet too in just a second here. But that number is the one that we typically will, if once you're above 160, we'll give you a try for about 6 to 8 weeks to make some diet and exercise changes, and then repeat those numbers. And if that bad cholesterol is still quite high, we know that you're at a higher risk of having heart disease, heart attack, and that includes stroke. So it's all part of the same artery tree. Your brain, your heart, everything is all connected. So the better we treat those, we decrease the risk of heart disease and stroke. So if your if that LDL, that bad cholesterol is less than 160, in addition to diet modifications, and if you don't have, other risk factors, a strong family history of heart disease or diabetes, or especially as we get a little bit older, that's a risk factor by itself. If you're kind of in that intermediate range, less than 160, again, we will still recommend diet, but your doctor may recommend additional testing. What you see on the screen here is a test that they may recommend for you, which is a calcium score. It's a low radiation CAT scan that essentially is a very quick scan, and it looks at hard plaque. So what happens as that artery, as the plaque or the cholesterol and all of that debris builds up within the wall of the artery and it starts to narrow, over time it starts to harden and become calcified. So on the left of the screen of the calcium score of 0, just for orientation purposes, this is your aorta that I'm circling here in the center. And then this line here is an artery that's going down the front of the heart. And then this one here is peeking around and going around the back of the heart. This relatively is clean. There's no calcium or hard plaque there. That's a calcium score of 0 compared to the one on the right side. Whereas if you look here, the aorta is gray, but then you have these very bright white speckles. And then in that same area, the artery going down the front, it's very, very white, very dense. That's calcium. That is a very heavily calcified, a lot of debris within that blood vessel. Now, CAT scans do have limitations. They don't tell us how narrow that blood vessel is, but that right there tells me that there's heart disease present. So in addition to a calcium score that's 100 or greater, and you have a LDL or bad cholesterol that's high, your doctor may recommend medication, again, to drive down your risk of developing heart disease and to kind of stabilize that plaque that's within that artery. So our goal with medications, which I'll talk a little bit about, our LDL goal from a heart disease standpoint, that number we like at less than 70. There's really no, I won't say there's no low number that, that would concern us, but less than 70 is the one that we target, because we know that decreases your risk of having heart disease. So if you have known coronary disease, if you've had stents, if you have a calcium score or at a CAT scan and you have that hard plaque or calcium within the arteries, if you're diabetic, if you have kidney disease, all of these things we like to target and bring that LDL or that bad cholesterol way down to 70. We know that that's more protective and preventing heart disease and hopefully preventing a heart attack or stroke. So diet and exercise. So diet, of course, less processed, the better. All of my patients, I tend to counsel them on avoiding processed foods. Anytime you look at the nutrition label and there's about 100 or 50 things on there that you can't even pronounce, that is way too processed. Try to avoid that type of food, eating more fresh vegetables, fresh fruits, things that tend to lower your cholesterol, beans, vegetables, whole grains, berries, Plant-based proteins, salmon, you just have to be careful not to eat that every day just from a mercury standpoint. But obviously the more vegetables in your diet, the better. Beans, lentils, whole grains, all of those things will help drive that bad cholesterol down, drive your triglycerides down, and also increase your good cholesterol, which is your HDL. In regards to exercise, I always tell patients the form of exercise that you enjoy the most is the one that you should do. So if you're not a runner, if you don't like biking, or you just pick an exercise that you enjoy. If you like dancing, if you like, walking, you just have to commit to doing something. The American Heart Association would recommend 30 minutes a day of 30 minutes a day, 5 days a week of moderate intensity aerobic activity. They say 150 minutes, but I break it down to 30 minutes a day, 5 days a week. Even if you're an active person, you got to try to get in that 30 minutes of specialized time to get that activity in. Again, that activity can be in a multiple different ways, whatever you enjoy. I tend to tell patients, especially as we get older, you do not need to do any high intensity aerobic training unless you're training for something specific. Especially my older patients, I do not recommend high intensity training. So that's your HIIT training. So moderate intensity is really all you need. So and what I mean by moderate intensity, you're not breathless. You're able to, if you're walking or dancing or biking, you're able to have a conversation. You feel it, your heart rate's up a little bit, you maybe even be a slightly winded, but you should still be able to carry on a conversation. If you're exercising to the point where you cannot talk, you're huffing and puffing, you are moving too fast, that's beyond what you need, slow it down to a more comfortable pace. So moving from diet, there's multiple different medications that we use. The statins are the most effective. That is your atorvastatin or Lipitor, which is the brand name, rosuvastatin or Crestor, which is the brand name for that one, simvastatin or Zocor, pravastatin or Pravachol. All of these are statin medications. They've all been shown to decrease your risk of heart disease, particularly if you have known heart disease, if you've had stents, if you've had bypass, if you have a high calcium score, if you're diabetic, if you have kidney disease, all of the risk factors that we've talked about. Statin medications will drive down all of that cholesterol and inflammation that's responsible for that plaque buildup within the arteries and is protective from heart attacks and strokes. The biggest pitfall for your statin medications is that it can cause side effects. In some patients, it can cause what's called myalgias, or which are muscle aches and pains. If you have that after starting a statin medication, then your doctor may either decrease your dose or switch you to a different one, one that you'll be able to tolerate. But if you have muscle aches and pains, especially after starting the medication, you certainly have to talk with your doctor, because that is a side effect that we need to know about, so that we can make adjustments to your medication. The ones that are the best and the ones that we typically tend to use in heart disease are the Lipitor or atorvastatin, or the rosuvastatin or Crestor, just because they have a higher potency, meaning they're more effective than your simvastatin and your pravastatin. But there may be reasons why your doctor may want you on the pravastatin or simvastatin. And I just want you to be aware that if your doctor placed you on simvastatin or Zocor in the past and you had issues with muscle aches or pains, that doesn't necessarily mean that you won't be able to tolerate the Lipitor or the Crestor. So your doctor may want to make some adjustments to your medications to see which one you tolerate. But if you have heart disease, those medications are fantastic in preventing heart attacks and strokes. Another medication that we use in addition to the statins is another medication called Zetia. We tend to use that if your cholesterol is not at that goal, that LDL is not responding, in addition to diet and the statin. Your LDL is not at that goal that we know is protected, that LDL less than 70. If it's not there, then we may start you on a medication called Zetia. That's a once-a-day medication. That again is very helpful, and it's in addition to the statins, or if you cannot tolerate the statins, meaning we've tried all different ones and you're still having muscle aches and pains, you often don't need to power through that. Certainly tell your physician about it, because we don't want you to power through that. That's a side effect that we need you to bring to our attention. There's a newer medication on the market that's actually been around for a little while now. These are what's called PCSK9 inhibitors, and that's just a fancy name for a medication that actually very, very well drives down that bad cholesterol, but it's an injectable medication. And you typically have to have side effects with the statins in order to qualify for this medication. And you can inject, there's different injections either every 2 weeks or every 4 weeks of either one of those, but your doctor may actually recommend that, especially if you cannot tolerate the statin medications and we need to protect you from heart attacks and strokes and your cholesterol is really high. It's a great medication. You don't have the muscle aches and pains and or the myalgias that you may have with the statins, but it's a fantastic medication. So your doctor may recommend that for you. Moving on to diabetes, which is another very big risk factor for heart disease. So this is a busy slide, but I like pictures. So looking at the left of the screen, diabetes affects more than 30 million adults in the United States. 1 in 4 adults actually surprisingly don't know they have diabetes. So what happens when you have diabetes? That means either your body fails to use insulin correctly or your pancreas just fails to create enough insulin. So some of the symptoms that may happen related to diabetes is you're all of a sudden extremely thirsty, or you're hungry even after eating, or you're frequently having to go to the bathroom and urinate. If you cut yourself and your wounds don't tend to heal very quickly, that could be a sign of diabetes. Numbness in the hands and feet, because those blood sugars, which I'll get to on the right side of the screen, can be very toxic to the nerves. So you may have this burning, pins and needles, numbness, tingling in the feet and hands that may be related to diabetes, and then blurred vision. So when those blood sugars are so high in the body, they can affect all of your organs. They can affect your eyes, they can cause strokes, they can certainly cause plaque buildup. As we talked about a little bit earlier, your arteries are all part of the same tree. So the arteries, and if you have blockages or hard plaque in the arteries of your heart, there's a good chance that you have them in the arteries of your brain, your legs, all of the blood flow to your kidneys. It's all part of the same tree. So what happens, same thing happens with diabetes, is that those high blood sugars can cause damage to the heart. They're toxic to the nerves, giving you that pins and needles pain. The wound healing is a big thing. They can cause strokes, kidney failure. So making sure that we treat your diabetes is certainly something that is very, very important. Then just to go back to this, you make sure you follow up with your primary care physician. There's blood tests that they can do routinely that will be able to check you for diabetes, and then they will be able to manage you, whether that's with insulin or with other medications, and also, making adjustments to your diet will also help with that as well. All right, and so going into some of the just general treatments for heart disease, I know it was in the news recently that baby aspirin was harmful. If you have heart disease, you need a baby aspirin. Unless there's some reason that your physician took you off of a baby aspirin, the 81 milligram baby aspirin is the treatment that we use for heart disease. If you've had stents, if you've had bypass, 81 milligrams of aspirin a day is all you need. Your doctor may want you on, if they took you off for another reason, that you got to make sure you speak with your doctor about that. But if you have heart disease, if you have a high calcium score, even if you've never had a coronary angiogram or angioplasty, stents, or anything like that, if you've had a high calcium score, like I said before, you have heart disease. So putting on that baby aspirin, again, helps stabilize that plaque and also help kind of thin your blood out just a little bit. It's not technically a blood thinner, but it does kind of allow the blood to be just slightly thin enough to get past those blockages, so that if you do have narrowing, they hopefully won't become a problem. So in addition to the aspirin, statin medications, and then you may be on a medication called a beta blocker. That's either metoprolol, carvedilol, combination of those. Those tend to slow down the heart rate and allow the heart muscle to work a little bit more effectively. And also decrease the demand on your heart too. So all of them are beneficial. These are usually the mainstays, particularly if you have heart disease, if you've ever had a heart attack. These are the medications that you may be on, and that's why you're on them. Non-medication, diet, diet, diet. Again, avoiding processed foods. If you look at the nutrition label, and again, there's about 50 things on there you can't pronounce. It's too processed and you probably shouldn't eat it. More vegetables. Doesn't matter what type of the vegetables they are, unless there's a dietary restriction because of if you're on a blood thinner that it doesn't allow you to eat green vegetables, green leafy vegetables, but there's so many vegetables out there that are of different colors and things that are good for you, that have all of these nutrient properties that are good for you. So eating more vegetables, eating more lean proteins, grilled chicken, grilled fish, things like that. Exercise, again, even if you're a very active person, that's wonderful and I want you to be active, but making sure that you include that 30 minutes a day of dedicated moderate intensity aerobic activity. So whatever you enjoy, whether that's biking, dancing, walking, just getting that exercise in. Also, if you have heart disease and you've had a heart attack, you've had angioplasty, you've had bypass, your doctor may recommend that you go to a program called cardiac rehabilitation or cardiac rehab. It's a fantastic program. They find a location that's close to your home. And not only do they do a lot of education about heart disease and heart failure, but they do a lot of exercise training, because if you have heart disease, you may be a little bit concerned about what you're able to do, especially if you've had a heart attack. You may be concerned about exerting yourself more than you think you can. So this program has wonderful physical therapists and exercise physiologists that will actually work with you and monitor you very closely so that you can gain your confidence back and get back up to that 30 minutes a day, 5 days a week, which is what we recommend. Prevention is always best. And again, I'm gonna preach a little bit more about diet because I think it's very, very important. And I also just want to take some time so that you understand what your nutritional label, what you're looking at. So the first thing I want you to clue into when you're looking at nutrition facts is look at the top. It's always going to give you the serving size and then the servings per container. So if it's a seemingly small container, and you eat the whole thing and there were 8 servings per container, you have to take all of these numbers, the calories, the sodium, the fat, and multiply that by 8. So you want to limit, if it's something that you really enjoy, you want to limit to the serving size. So pay attention to the serving size and the servings per container, and note that the serving size, all of these numbers, the calories, the fat, the sodium, the protein, the carbohydrates, all of those numbers apply to one serving size. So whatever this, food is that's on this nutrition label, it's 230 calories per 2/3 cup, 160 milligrams of sodium per that serving size of 2/3. Limiting your salt or sodium intake is helpful, particularly if you have high blood pressure. If you want to kind of look into and kind of target no more than 2,300 milligrams of sodium in a day, I often find it's hard for people to kind of sit there and calculate that. So I say a good rule of thumb is if you look at the sodium, there's always a percentage on the right side. If it's greater than 7%, there's probably too much sodium in that container, particularly if you have risk factors. If you have high blood pressure, you want to stick to less than 7%. If it's greater than 7% per serving, it's probably too much sodium for you. If it's something that you really, really want and you just say, I really want to have this is going to be my treat for the day, and it's higher than that 7% sodium, that's fine. Just make sure you stick to the serving size, because everything in moderation is okay, right? So if you stick to that serving size, that I think you'll be okay. Again, maintaining a healthy weight. That physical activity is very, very important. every week. The American Heart Association, again, would recommend 150 minutes of moderate intensity aerobic activity. So that's 30 minutes a day, 5 days a week of dedicated activity. Whatever exercise you enjoy, that's what I would recommend. If you're a smoker, certainly quit. We have a lot of resources available, so I would encourage you to reach out to your primary care physician or your own physicians to help you. Smoking is another major risk factor for heart disease and causing, blockages and buildup within those arteries. And it certainly increases your blood pressure, but it puts you at a much higher risk for strokes and heart attacks. So quit smoking, limit alcohol use. Men should have no more than 2 alcoholic drinks per day, and women should have no more than 1 alcoholic drink per day. Make sure you get enough rest. Sleep is very important. And also reducing stress. I tell patients all the time, stress hormones are released when you're stressed. Unfortunately, there's only so much we can do about stress. But those stress hormones are great when you're running from a bear, not so much when you are in day-to-day life. So try to do something every day that's mindful, that is going to kind of limit your stress, whether that's taking a walk or reading a book or, doing something for yourself that's going to have you reconnect with yourself and do a little bit of mindfulness just to reduce your stress, because your mental health and your physical health both go hand in hand. And that is all I have for my presentation, and I will open it up for questions.
Thank you, Dr. Fuller. We only have one question in our chat box, but that question is, what is the lifespan of a stent?
So your stents are with you for the rest of your life. Once they go in, they don't come out. Most of the time, once the stent is placed, as long as it's optimized, and there's different techniques that we do as an interventional cardiologist in the cath lab when we're putting the stent in. There are different things that we do and different things that we look at. But typically that stent, as long as you take your medications and you work on your diet and exercise and all of that and do all of the good things that we talked about today, that stent should last you and should not clog up for a good 10 to 12 years, if not longer.
I see some hands raised. If you could just type your question into the chat box. The next question is, why is HIIT harmful if you think that you're healthy? The high intensity aerobics?
So high intensity aerobic activity is not harmful. It just, unless you're training for something specific, it just increases your risk of injuries occurring and happening. If that's something that you've been doing and you're used to it, that's fine, but also incorporate some lower or at least moderate intensity activities. It's just not healthy just for your joints and bones to work at that high intensity for so long, especially if you're doing this every single day.
The next question is, can you have heart problems without high blood pressure?
You absolutely can have heart problems without high blood pressure. I typically tell that especially my younger patients, that have normal blood pressure, no cholesterol issues, they're not diabetic, but they come in with a heart attack, but everyone in their family has had heart attacks. You cannot run your genes. So if you have a very strong family history, there's a very strong genetic component to heart disease. So if you have a strong family history, absolutely, you can certainly have heart disease without having high blood pressure.
The next question, what is diastolic dysfunction?
So diastolic dysfunction is a marker or measurement that we measure when we do an echocardiogram or an ultrasound of your heart. And it's something that happens just as we get older. Your heart just gets a little bit stiffer. and just doesn't receive blood as nicely as it did in the past when you were younger. Doesn't necessarily mean that it's a problem. You can see it also with longstanding high blood pressure. It's just something that we keep an eye on, and make sure that, you know, we're making sure your blood pressure is under control, and controlling and hopefully preventing heart failure, because that diastolic dysfunction can eventually cause heart failure over time. But it's something that you have to work closely with your doctor to make sure that that doesn't happen.
Okay, and the next question is, I'm trying to prevent heart disease. I don't have any risk factors other than age. What source of protein is heart healthy?
So I would say lean meats, so grilled chicken, grilled fish, plant-based proteins are perfectly fine. You just have to be very careful with fish and not eating it every day, just from a mercury standpoint. But yeah, you can get plant protein, lean meats. Any of those are fine. I typically tell patients to avoid red meat, and not eat it as often. And pork just is a very salty animal, so if you like pork, I would tell you to limit that. But you know, grilled chicken, grilled turkey, all of those things are fine.
And the next question is, would they still put you on blood pressure medicine if you have a heart problem without high blood pressure?
Yes. So if you have had a heart attack, um, if you have heart failure, or where your heart muscle isn't as strong as it normally should be, you actually may be on that metoprolol, or that beta blocker medication that's, again, helping with the heart function and helping with the heart, what's called remodeling, which is essentially the heart muscle tries to repair itself. So yes, you may be placed on medications that are typically blood pressure medications, but they're designed to help the heart function improve, or hopefully prevent the demand on the heart.
And the last question we have is, can plaque be reversed?
Unfortunately, it cannot. Once it's there, but it can be stabilized. So even though it's there, we can stabilize it with diet, exercise, and medication, but it doesn't typically reverse.
And one last question that just came in, it's about diet again. Are fruits such as cherries and grapes a problem for your heart?
Nope. So the only problem with the fruits is that, especially if you're diabetic, there's a lot of natural sugar in fruit. So if you are diabetic, I would recommend that you talk with your nutritionist, your diabetic nutritionist, to get a better idea of what fruits are better for you. But no, there's no harm with any fruits, especially that, you know, the fresh fruits that you can get are always going to be good for you, especially from a heart standpoint.
Okay, Dr. Fuller, there's no more questions for you. There is a question about whether this presentation will be available later, and it will. It's being recorded and will be available online. Oh, do you have time for one more question?
I do.
Okay, so my doctor has me taking blood pressure 2 hours, my blood pressure 2 hours after my medications. Is that okay rather than first thing in the morning?
That's okay. Yep. And if you have concerns about that, I would certainly, you know, recommend that you talk with your talk with your doctor, and just because it sounds like you may have a little bit of concern as to whether or not that's the perfect time of day to take it. I'd say just stay consistent with the time of day you're taking it. So if it's 2 hours after you take your blood pressure pills, that's perfectly fine. But if you do have specific concerns, about the timing of checking your blood pressure, I would certainly recommend that you bring those up with your physician, with your doctor.
Okay. So this brings us to the end of our event. On behalf of Dr. Fuller and the Senior Healthy Living Program, thank you for joining us to learn more about aging and your heart health. For those of you who have registered for the next lecture in this series, we look forward to seeing you this Friday, February 24th at 3 p.m. for Dr. Arfat Khan's discussion on atrial fibrillation, What You Need to Know. There is still time to register for the Friday event. Go to henryford.com/healthy living and follow the link to the lecture series. Thank you again and enjoy the rest of your evening.